The number of Americans seeking medical care overseas is on the rise.
What flight is this?
A trend that has been simmering for years is now on fire.
I'm ready.
Americans believe that we have the best health care in the world right here in the United States. And that is actually not necessarily the case. One can get very, very high quality care, and in some cases better quality care, outside of the United States.
Places like Thailand, fast becoming an international leader in the healthcare field.
The growth in the cost of health coverage is significant, okay, and we know that. And there's nothing in sight that says that we're going to make the kinds of radical change that are needed. Total revamp of the U.S. healthcare system. It is about the cost of healthcare.
Whether it's heart surgery or whether it's orthopedic surgery, whether it's treatment for their diabetic conditions or anything else, they're probably foregoing doing some of the things that they should be doing. Executive physicals would be the best example. You want a wonderful vacation, you do an executive physical here, it's going to cost you between $10,000 and $15,000. You can go over to Thailand, you can have the same executive physical for a third or less. From what we heard with the statistics when we were there last year, one of the hospitals had 18,000 visits from U.S. citizens. A technological point, from a labor point of view, from a customer point of view, it was just far superior than what I could have ever imagined.
I think most U.S. doctors are not very aware of the options that are available and the level of competency that exists in many areas, particularly in Thailand.
Globalization is a pretty powerful force. And as one of my colleagues said, it's rather unrealistic to think that we'll trade in other goods and services with our trading partners, but not trade in healthcare services.
People would never have been comfortable thinking about buying prescription drugs anywhere but in the United States, okay? But now look, people want to buy prescription drugs from Canada, from Israel, from Europe, from Asia.
The fact that there's going to be this fear factor of getting on a plane, having to go through passport control, and getting to a new country or a city that doesn't speak your language, that's the fear factor. Once you get in there, you'll see that there's the concierge desk, and they've got an American ward or an English-speaking ward or a Japanese ward, an Arabic ward. I mean, I was so impressed when you walked into there. They had people that could speak your language, they could understand what we were doing, and they could be able to relate that back to the patient. So they have instructions both in Thai and in English. That was, in our case, that's what we were looking for. And the fact that so many of those physicians over there are trained here in the U.S. and are board certified here in the U.S. and to some extent higher percentages of that training than even in normal hospitals here in the U.S.
What I've seen in healthcare in Thailand is a commitment to being Thai. They are thrilled to have visitors. They feel it's an honor. And they state that and they live it. The fresh orchids in your hospital room, the 42-inch plasma TV. So they're ready for us.
To help Americans better understand the quality of Thai healthcare and its extraordinary attraction as an ideal place to relax and recover, Meds Global Healthcare, a Los Angeles-based company establishing centers of medical excellence in Thailand, and the Thai Tourism Authority teamed up for an unprecedented conference to share information.
And the physicians that want to learn the procedure and the facilities such as Ramatipiti and so forth that want to embrace this type of procedures are usually leading facilities that really want to be on top.
Forge new friendships and shape the future of American healthcare in Thailand.
The global healthcare crisis is a worldwide phenomenon. In Thailand, if we can organize and work together, that we can participate in some of the solutions that will help not only the nation, our people, but the world as well.
It is now accurate to say that medical treatment in Thailand is at least as good as medical treatment in the most advanced countries in the world.
I believe that it has all the ingredients for success if both Thai and American healthcare sector could join hands.
I noticed on a lot of literature it says amazing Thailand, and it is just that. It is amazing.
In our country, we have many aspects and to offer on the medical tourism for the Americans. Thailand can offer all the attractions or the destinations after your treatment. We have a variety of attractions, not only in Bangkok, but I mean in the north, which is the hill tribe, mountains, and in Chiang Mai area, or even in the beach resort. You can go to nearby our Bangkok, like 2 hours drive to Pattaya or to Sham Hua Hin, which is the beach resort already, or in the south, there is a very famous island like Phuket or Koh Samui in the south. So I think that we have many attractions to have a destination to relax after your medical care or treatment in Thailand.
If you say, well, I think I'd like to use a hospital in Bangkok, okay, it's in your network. If the model works correctly, the insurer would also, because of the efficiency in working with Thailand, the cost efficiency, that they would actually even pay for the travel.
Something like only 15% of the people in the United States even have a passport. Well, how are they going to go over abroad, if they don't even, feel comfortable leaving the U.S.? So I think conferences like this of bringing the Thai tourism people here and bringing the TAT here is going to help the normal person understand that there's more going on across, this continent than just what we see here on the domestic scene. They just are going to have to keep going out there and putting the word out there.
I was very impressed by seeing and hearing about the quality of some of the hospitals in Bangkok. And I think a great deal of information that could be transmitted to physicians and hospital administrators here would be helpful.
I think the value of a company like MEDS is MEDS Global Healthcare probably will take the fear out of most of the patients' concerns when they're traveling abroad. And I think by being able to have a base here, and whether you start your care here, you go over there, you have your treatment, and you finish your care here, you've got a team of people looking out after you.
If the system is going to work well, it will be because you have a relationship between physicians and institutions in the United States and physicians and institutions in whatever other country it is, so that the patient can go with their medical records and come home with their new medical records.
MEDS Global Healthcare's model essentially is a continuum of care. The facilities are screened for quality control by doctors. The patients are screened in the United States before they go to Thailand. They're followed by the same doctor when they come back. So it's really a full continuum of care.
I think it's very exciting because there's the promise of lower cost and higher quality. Whether it's overseas or whether the competition from overseas forces us locally to have lower costs and higher quality. But either way, I find it reassuring.
I truly believe that when it comes to all the players, at the end of the day, if we truly get to the point of saying that what is in the best interest of the patient, then we all come together.